Great. Thank you, Kat. Welcome everyone to the Mo DDD and You November webinar. A quick reminder that these 30-minute monthly webinars are geared toward providing meaningful information to families and individuals in a shorter amount of time. So they go pretty quickly, but they still have a lot of really good information. This month, we're going to focus on waiver renewals for 2 of the 4 waivers that are available through the Division of Developmental Disabilities. These 2 waivers are the Missouri Children's Developmental Disabilities Waiver, or what's known as the MoKids Waiver, and the Partnership for Hope Waiver. We're going to give you an overview of what a waiver is, talk about who can access waiver services, and then we're going to review the 2 specific waivers that I just mentioned. We're also going to spend some time hearing about the waiver renewal process and the importance of gathering feedback about services from stakeholders, which includes families and individuals. Now, as a parent of someone who receives waiver services through the division, I can understand that many folks might be feeling a little confused right now. You might be thinking, waiver? What in the world is a waiver? You might be familiar with some of the services that are available through the division, but understanding where they come from and how they are paid for might be a little more vague. Today we have Emily Lubering and Leslie Bradley of the Federal Programs Unit for the Division that are going to help walk us through that information and provide the overview today. So Emily and Leslie, if you guys are ready, I will turn it over to you.
That sounds great. Thanks, Lisa. Myself and Leslie are very excited to be here today and appreciate the time to present on what an HCBS waiver is and the renewal process for the upcoming Partnership for Hope and MoKids waiver. The first slide we're going to start off with is what is a Medicaid HCBS waiver. So what is a home and community-based waiver, otherwise known as HCBS? Home and community service waivers provide community services to participants who otherwise would be placed in an institution, a nursing home, or a hospital to receive long-term care. Basically, an HCBS waiver is about participants having the most integrated lifestyle as possible. Examples of HCBS waiver services include personal assistant, day habilitation, specialized medical equipment, and employment services, plus a whole bunch more services that our waivers provide. Those are some of the ones that you might be familiar with. These services assist participants to live in the community. Medicaid funding for the HCBS waivers in Missouri consists of state dollars, with approximately 64% of the dollars coming from federal. To be eligible for an HCBS Division of Developmental Disability waiver, the individual needs to be eligible for the Missouri Division of Developmental Disability, be Medicaid eligible or MoHealthNet eligible as determined by the Missouri Family Support Division. They also need a need for intermediate care facility for individuals with intellectual disability level of care. This means that they meet the definition of a developmental disability with 3 substantial functional limitations, have an active HAB need, reasonable indication that the individual has needs that could be met with an ISD level of care, so that intermediate care facility, unless provided home and community-based services under the waiver. The level of care in ICF is determined initially at the time of the review process, and then the individual will be reevaluated at least annually or as specified in the approved waiver.
So Emily, this is Lisa, and I think some folks might be familiar with the term of LOC, but some of this, the abbreviations that we're talking about today are sometimes confusing. But I think a lot of folks can relate to the fact that they know that somebody's coming to their house to do an LOC with them. And that is what you're talking about, correct?
Yes, level of care and LOC, determining if the individual, what level of care an individual needs to meet their needs, if they would maybe need to be in a intermittent care facility or residential or different levels of care. And we are looking for that ICF level where then home and community-based services can be provided to keep the individual in the community.
Okay.
Does that make sense? Yep.
Yes.
Okay.
It's just a point of clarification. I can remember going through this as a parent myself and being so confused with some of the jargon, but as you kind of get into the system, when you hear people talk about LOC, this is what we're talking about.
Yep.
Okay.
So next, we're gonna just gonna go over quick. This slide shows the Missouri waivers administered by DMH and DD. We have 4 waivers: the comprehensive waiver, which began in 1989, the MoKids waiver, which started in 1995, the community support waiver began in 2003, and our newest waiver is the Partnership for Hope, which was started in 2010. Today, our focus will be on the MoKids and the Partnership for Hope waiver, as those are the 2 waivers that are coming up for renewal in July of 2023. And now I'm going to hand it off to Leslie Bradley, and she's going to share more about the MoKids waiver.
Thanks, Emily. So as Emily just shared, Missouri implemented its MoKids HCBS waiver in 1995. The targeted population is children with developmental disabilities, and the division currently has the capacity to serve 366 children in this waiver. The last MoKids waiver application was approved by Centers for Medicare and Medicaid Services, or CMS, effective July 1st, 2018. So the next 5-year waiver renewal will be in 2023. This is a quick slide on what you need to know about the MoKids waiver. Again, this waiver serves 366 children and does not have an annual cost cap. The child must be determined not eligible for any MoHealthNet program. If the child has a MoHealthNet spin down or premium, the family must explain why this is a financial hardship and cannot be met, even with medical expenses. The child has to be living at home with family and also under the age of 18 to be supported in the MoKids waiver. The MoKids waiver is not for children who only need MoHealthNet or what we call also state plan services, such as private duty nursing. Private duty nursing is not a service through the MoKids waiver. And services available in the MoKids waiver include 15 services to meet the needs and flexibility of the children supported in this waiver. And they include applied behavior analysis, assistive technology, community networking, community specialist, crisis intervention, rehabilitation, environmental accessibility adaptations for home or vehicle, in-home respite, individual directed goods and services, individualized skill development, out-of-home respite, personal assistant, specialized medical equipment and supplies, support broker, and also transportation. And I'm going to hand it back over to Emily to tell you about the Partnership for Hope waiver.
Thanks, Leslie. The Partnership for Hope waiver is our newest waiver, and it began in 2010. It has 25 services. It has an annual cap in an individual in this waiver of $12,362. So if you're in this waiver, your max cap for the services would be that $12,000. We currently serve over 2,000 participants, and our next renewal date for the Partnership for Hope and the MoKids is 2023. This waiver is a little different in that It is actually a partnership with counties. It's a county-based waiver, and we work with the counties that are here shown on the map with a greenish blue color. Those counties participate, partner with the division to provide services under the partnership waiver. Some important facts about the Partnership for Hope waiver is, I mentioned, the waiver has an individual cost cap of $12,362 per person. The county and the division will each pay half of the state match for the Partnership for Hope waiver participants. As I mentioned before with the waivers, it's a combination of general revenue dollars from Missouri and federal dollars. So the county and the state will share the expense for the partnership participants. The partnership waiver has a couple services that are only provided under the partnership waiver, and those are the family peer support, dental, and temporary residential services. And lastly, the participant must be residing in the participating county and meet a crisis or priority criteria. This next slide shows all the services that are provided under the Partnership for Waivers, under the Partnership for Waiver. You'll see that we have 25 under here, and we have applied behavior analysis, assistive technology, benefits and career planning, community networking and community specialist, community transition, rehabilitation, dental, environmental accessibility adaptations for vehicle modifications, family peer support, individual directed goods and service, individualized skill development, job development, occupational therapy, personal assistant, physical therapy, pre-vocational, professional assistant and monitoring for registered nurse, licensed practical nurse, and registered dietitian, specialized medical equipment and supplies, speech therapy, support broker, supported employment, temporary residential service, and transportation. The waiver renewal process. Home and community-based services 1915C waiver applications renew every 5 years. So we actually this year renewed the other two waivers, the comprehensive and community support waivers this year. And as we've completed those, we're now started work on the Partnership for Hope and MoKids for 2023. And those are set to renew, as I mentioned, July 1st of 2023. The waiver renewal process starts several years in advance of the waiver renewal date. That's why it's 2021, but we're already working towards our renewals for 2023. And the reason we do that, start early like now, is because there are a lot of steps involved in the process. And this slide outlines the waiver renewal process. One of the first ones on here is your stakeholder input. And that's where we're starting to want to present to groups and provide information about the waivers so that we can collect feedback for the waiver renewals. The next steps are reports for performance measures. We go out for public comment, both informal and formal comments on the changes that are they're proposed for the waivers. We also, MoHealthNet review of changes, submission of the waiver application to CMS, and then we do a question and answer with CMS. CMS will ask us questions about the changes, and the state will provide answers, and then CMS eventually will the waiver approval so that we can continue to provide the services. So we need your help. Stakeholder input. We're looking for ways to involve the stakeholders, which includes individuals, families, providers that utilize the services. We want to share with your organizations that we're starting the renewal process for Partnership for MO Kids. We ask that you watch for surveys and webinars coming to encourage involvement in the waiver renewal process. And then we ask if you have suggestions on ways that we can best reach individuals and families and stakeholders, please share them with us so that we can utilize our different avenues to get feedback from individuals, families. This next slide provides resources for the Missouri Medicaid Waivers fact sheet, MoKids eligibility requirements, and the Partnership for Hope summary. If you need any further information or have additional questions, we ask that you send them in an email to the attention of Emily Lubering or Leslie Bradley at the ddmail@dmh.mo.gov. And then I'm going to hand it back to Lisa to share about the next Mo, DD, and U webinar and any wrap up.
All right, thank you guys, both of you, for providing that overview. I know it's a lot of information. It can be very confusing, and it's in a short period of time, so I know we kind of blocked through it pretty quick. But I do encourage everybody to go back to those resources that Emily shared and explore those out on our website, gain some more information, and get a better understanding of what the waiver services are and what they have to offer. I also want to reiterate the importance of providing feedback to the division about the services that you receive or need. Remember that individuals and families are the end users, and your voices can help improve and shape the current services and even help create new ones. So spread the word, let other families and individuals who also receive these waiver services know about the need for feedback, as Emily said. And before we wrap up, I want to remind you to mark your calendars for the next Mo, DD, D, and U webinar, which is scheduled for Tuesday, December 28th. Again, the time frame from 12:30 to 1. And I also want to put a plug in. We have a new Facebook page. The division has started a new Facebook page. So if you're a Facebook user, jump out there and look us up and like our page and follow along. We are putting a lot of different posts with resources and events and information that pertain to the division, as well as developmental disabilities in general. So with that, I think we're wrapping it up. That concludes our presentation. And do we have any questions in the chat? Yes, it looks like Cass Kennedy is asking if there will be a copy of this presentation that will be sent out. It will actually be included on the division's webinar page. The presentation will be there, a transcript will be there, as well as any question and answers that we get. We'll put a Q&A document out there as well. And I'm not seeing any other questions. Kat, did you see anything come through on your end?
Nope, we're good to go.
Okay, any closing remarks, Emily or Leslie, either one that you want to focus on?
Just thank you for letting us speak today. And I think just echoing what you said, Lisa, we really do want input from our individuals, our families, stakeholders.
All right. Yeah, that voice is very important. You know, in thinking back, the way services have been created over the years, historically, it's been because of the voice of families and individuals out there that needed services and the advocates. So always encouraging folks to speak up and let your needs be known and give us the information that we need. There's always room for improvement. So if you've got something that you would like to share as far as services that would help this renewal process, we strongly encourage you to reach out and email Emily and Leslie at the email address and let us know your thoughts. Thank you very much.